So there are two ways to think about how the government spends: the financial way, which is the mainstream approach, right? Where are you going to find the money to pay for the spending? And then there is the MMT way, which doesn't ask the question of where you're going to find the money. It focuses on what you're spending on and whether there is stuff to buy, right? That's the important question. We can't find the money, but can we find the stuff to buy, or the resources that Jeff was talking about? So the mainstream approach of where we're going to find the money just equates the government, the national government, with a household. Of course, everybody knows that households have to find income or borrow to be able to spend. And the same thing is said about the federal government. So we have to raise revenue through taxation, or if we can't do that sufficiently and we're running a deficit, then we have to borrow, we have to issue government bonds. In other words, we're running up the national debt, and there is going to be a reckoning time for that. Or worse, we're leaving this debt to our grandchildren who have to pay it. So we're spending today and we're leaving the debt to them to pay. So it doesn't sound like a good scenario either way. So then that limits what your government can supposedly do, because there is a limit to government raising taxes, and then there is the limit of being able to borrow. Well, MMT reverses that and notes that there is a major difference between a government and a household, and that the government is the currency issuer and households are currency users. So users have to find the money before they can spend. And for the currency issuer, it's the exact opposite. You have to spend before you can get the money back. So I have a classroom currency that I use in my classes. I call my currency the Franklins because it's Franklin and Marshall College. And so the first day of class, I walk in and I tell my students that they now owe me a tax of 25 Franklins. And of course, they then wonder how they're going to pay this tax. And the tax is basically for their participation. And I tell them that they have to participate, they have to basically work for me, the government, and they have to sell services to me, so attend lectures or movie showings, etc. And they will be earning those Franklins along the way, and at the end of the semester, they can pay them. If I insist on that first day that they have to pay their taxes that day, none of them can do it because they don't have the Franklins to pay their taxes. So I cannot collect those taxes the first day of class. I have to first spend them. So I have to buy the services from my students, and I have to spend those Franklins into existence before I can then collect them at the end of the semester. So this shows the important point that the issuer of the currency has to spend that currency into existence before they can collect it in the form of taxes. And so spending has to come before taxes. For me, as the issuer of Franklins, of course, there is no limit to how many I can issue as long as I don't promise to convert them into dollars or something else. And the same is true for our federal government. There is no limit financially on how much it can spend. There is, however, the limit with real resources, which is what both Fidel and Jeff were talking about. There is a limited amount of stuff at any point in time that we can buy. So if the government wants to buy more than what's left over after what the private sector wants to buy, then that can lead to inflationary pressures, because the government can always outcompete the private sector precisely because they don't have financial constraints. So they can always pay a higher price, and that way they can get hold of those real resources at the expense of the private sector. And there are situations when this might be justified. You can think of a war, for instance. Of course, we did that during World War II with rationing and price controls and a whole host of other measures. You could also argue that trying to fight climate change could be a good reason to justify those kinds of resource shifts. But that's not really the norm for our economy. Usually there are unemployed resources left over. Capacity is not fully utilized. And of course, we always have, even best of times, about 4% unemployment. And that's the official unemployment rate, which can understate the actual employment situation. So resources are usually available. We usually leave them underemployed rather than overemployed, right? We don't usually hit that constraint that Fidel was talking about. And of course, that constraint is not fixed. We can through investments, we can expand that as well. But there is an important role for taxes to play in situations where we do hit that limit or we're close to it. Taxation can withdraw purchasing power from the economy, thus creating room for the government to try to get access to resources to pursue its priorities, to pursue the public purpose. It doesn't pay for spending, right? It's not there to pay for the spending. It's just used to create room for non-inflationary spending in the economy. And it's important to understand that when taxes are paid, what the government gets back is its own IOUs. So in case of my Franklins, right, what I get back when taxes are paid are my own IOUs. And I don't need to save them to pay the students next semester, right? There is no way for me to save them. It's all electronic entries, right? I just, do that all electronically with an Excel spreadsheet, and I don't need to save them. I cannot save them. In fact, because they are my IOUs, there is no way for me to save it. I do another exercise with my students in the classroom. I tell them, okay, take a piece of paper and write, I owe the presenter of this note $20 and sign it, right? And now put it in your pocket. So your own IOU in your pocket. Are you richer than before? And of course, the answer is no, you're not, right? Your own IOU in your own pocket is worth nothing. The same way when IOUs, the government IOUs go back to the government when taxes are paid, they're really worthless. And so, there is no way for the government to save its own IOUs. So it's important to understand that money is a tool that the government uses to mobilize resources and to hopefully fully utilize them and to pursue the public purpose, the national priorities that Fidel was talking about, whatever they might be. Now, how does all of this apply to Medicare for All? When you approach it from this mainstream taxes pay for spending approach, then you say, of course, obviously the government is going to spend more, so we have to raise taxes to cover that spending. But if you approach it from a real resource perspective, you actually come to completely different conclusions. So from the real resource perspective, one issue, which is what Jeff mentioned, was the availability of resources needed to provide healthcare. So doctors, nurses, medical assistants, equipment, drugs, hospital beds, and so on. So all of that is important. And those resources might not be there in the first instance. And so the question then is, how do you create them, right? How do you ensure that we do have hospital beds and doctors and medical assistants and whatnot? But another issue is whether with Medicare for All, as a society, we're going to actually need more resources or whether we're going to need less, right? We will need more specific kind of resources, such as doctors and so on. But overall, the question is whether Medicare for All represents an increase in total spending or it's actually a decrease. And I would argue that it's actually going to decrease the total demand on resources. How? Well, if you look at how much the US spends on healthcare, we spend about 18% of our GDP on healthcare. The next comparable country is Switzerland with about 12%. So they spend 12% of GDP on healthcare. And after that, it's France and Germany, and they spend something like 10 to 11% of their GDP on healthcare. So 18% versus 12 or 11% of GDP, right? So we are spending a lot more than our peers in Europe, for instance. So you could say, well, maybe that's because we're getting more real stuff, right? So we get more hospital beds and more doctors and nurses and so on. But study after study shows that that's actually not the case. We don't get more real healthcare services. We just pay more for the same amount of services that other peer nations are getting. And of course, the drug prices, that's no secret for anybody that we're paying a lot more for the same drugs here than they're paying in other nations, including European nations. So that's well known. But it's not just about drugs. It's also about compensation in general in the healthcare field, which is much higher, sometimes 1.5 to 2.5 times higher in the United States than in other comparable nations. So that's another thing that's driving it. So costs in general, prices are higher here, and that's what's driving our increased spending. So we're getting the same amount of real stuff, but we're paying more for it. That's one issue. The other issue is higher administrative costs. And this is where our private insurance system comes into play. So we have this middleman that intermediates between those who seek healthcare and those who provide healthcare. And this middleman is, of course, earning money in the process. And that adds to the administrative costs of our healthcare system. And so with a Medicare for All, you would be eliminating this middleman, right? For all practical purposes, you would be eliminating the private insurance industry. So you would be cutting your spending that way. So think of all the people who are employed in the private health insurance system. They would lose their jobs, they would become unemployed, they would lose their income, right? And we'll come back to this question. So in other words, this would lead to a decrease in spending and not an increase in spending, right? So that's that. And there's also the question of hospitals and doctors' offices having all these billing departments because they have to deal with different payers, private insurers, and the government and the individuals. And so, they're spending a lot of administrative costs there too. That they have to hire these people to get the money for the services rendered, and just to give you an idea, we spend about 8% of our healthcare spending on administrative costs, and other nations spend between 1 and 3%. So they spend between 1 and 3% of their healthcare costs and administration. We spend about 8%. So if we can cut the prices, which a single payer system would do, and if we can cut administrative costs, which again a single payer system would do, then we will actually lower how much we're spending on healthcare. So if we conservatively say estimate and say we're going to go down from this 18%, somewhere in between us and Switzerland, right? So let's say we're going to bring it down to 15% of GDP, which will still be higher than every other nation that's comparable to us, right? So even if we're spending 15% or 14% of our GDP on healthcare, we would be high up there, but that means that we would be lowering aggregate spending in the economy by about 3 to 4% of GDP. Okay, so we're not going to spend more as a society, although the government will be shouldering more of that spending. As a society, we will be spending less. So in a sense, Medicare for All is deflationary rather than inflationary. It's going to release resources on aggregate, right? So all of those people who will now be unemployed, you can then use them to pursue other priorities, such as greening the economy and whatever else you want to do. So that then means that if you want to raise taxes, which is the conclusion you come to from this financial approach, then you are doing the wrong thing, because raising taxes is freeing up resources, right? And you raise taxes when you need the additional resources. In this case, we are freeing up resources by implementing Medicare for All. So if on top of that, you also raise taxes, you're going to do the opposite of what you need to do. So all else equal, you could say that a Medicare for All would lead to the need for a tax cut rather than a tax increase because of the deflationary impact that it has on the economy. So just to give you an idea of this 4% of GDP cut that we could conservatively expect from a Medicare for All, the Biden Build Back Better, the original form, the two plans together, right? Social infrastructure and hard infrastructure bills together, they were a little over $4 trillion over 8 years or 10 years, something like that. So that came to about 4% of GDP, more or less, per year for, say, 8 or 10 years. 4% of GDP, right? And an increase in spending. So if you were to lower spending with Medicare for All by 4% of GDP, then you would be adding that additional 4%. If you implemented the complete Build Back Better, then you would be offsetting this decrease in spending with an increase in spending. But I'm just mentioning Build Back Better because that was seen as such a huge program of spending, right, that we couldn't afford, that we didn't have the resources to do it. What I'm saying is that if you combine that with something like a Medicare for All, you would actually be finding the resources needed to implement those spending programs. So to sum up, when we look at government spending from this financial pay-for perspective, we can actually come to the wrong conclusions about what needs to be done. And a Medicare for All is a perfect example of that. Financially, we can afford it. The government can pay for it just like it pays for everything else, just like it paid for those stimulus checks that we all got, right? One day you just woke up and there was more money in your account. Well, how did that happen? Well, it happened because your bank increased the number in your account, and the Fed increased the number in your bank's account at the Fed. And that's how all government spending happens, right? The Fed, Congress, Treasury, they are all involved in this process, and there is no financial limit on that. The real issue is resources, and whether we have the right kind of resources that are tailored for the healthcare system, such as the doctors, the nurses, the hospital beds, and so on. And this is where you might say, well, a comprehensive approach like a Green New Deal is even better, because if you include subsidized education there, then you kind of solve your problem to some extent of not having enough medical professionals, right? Or not needing to pay them as much because they have all the student debt that they have to pay back, and that's why their salaries have to be higher to compensate for that. So I'll stop right here, and I'll be happy to address questions later. I'll just conclude by reiterating the point that money is a tool that we can use to mobilize resources to pursue our national priorities, and that's the right way to think about money.